Well, it's 2 minutes past half past. So maybe we will kick off. I think a few people are still drifting in, but I'm sure they'll be able to catch up with where we are. But so thanks everyone for coming to this webinar about our Master in Public Health. So we've scheduled this for about an hour. There'll be, we've got some slides to talk to Enoch and I, and so we'll introduce ourselves. Crucially, excitingly, we've got Ankita with us today, who graduated the course last year to give her real reflections, having done it very recently. And so we'll also have some time to go through people's questions. If people do have questions, if you want to put them in the chat, that is good. And so Joe and Sylvia from our educational services team are on hand, and so they can answer a lot of those questions as they come along, and then any questions that we can't answer there, we can discuss, at the very end. So hopefully that all works fine. And do you mind going to the next slide, Henoch? So here we are. This is kind of the running order for the next little bit of time. And do you mind going to the next slide, Enoch? So this, to get into the introduction, so these are some of the key people. So this is obviously a picture of me from a little bit of time ago. But so my name is Anthony Laverty. So I'm the co-director along with Henoch, who can introduce himself in a second. But I've been Imperial since about 2009. I have been co-director. I've had the privilege of being co-director on the Masters for about 4 years now, and that has been really insightful in terms of meeting lots of students, getting those perspectives, and crucially educating the next generation of public health leaders. I A lot of my interests, my research interests when I'm not teaching on the MPH are around tobacco control. How can we deal with a product that is killing, at best estimates, about 8 million people a year, but also kind of wider interests in policy evaluation and health inequalities. So that is me. Henoch, do you want to introduce yourself here?
Thank you, Anthony. Hi, everyone. Really welcome to our webinar. My name is Henok Taddese. I'm a Principal Teaching Fellow in Public Health and co-director of the Master of Public Health course alongside Anthony. So I've been at Imperial for the last 10 years. Alongside my teaching, I have interests in policy analysis, research, but also looking at analysis of demographic and health survey data sets, nationally representative data sets, trying to look at behavioral health trends, and implementation research as well, mixed method research. In terms of modules that I lead at Imperial, I lead the research methods module, which is a compulsory module in the first term, and also the commercial determinants of health and health policy module with Anthony. Back to you, Anthony. Thank you.
Oh, sorry, everyone. I was muted. Thanks, Henoch. And also worth saying, we've got Professor Azim Majid, so he's the MPH chair, and Zainab Mullah, who's the course organizer. Go to the next slide, please, Henoch. And then also, so they're in the chat, they're sort of in the webinar at the minute, sort of answering people's questions. But so if you come, you'll be very familiar with Joe Type, Sylvia Yee, and Lauren Blake, who are really the backbone of sort of holding everything together in terms of the day-to-day running things, things actually working in practice. Next slide, please, Hannah. So just going to talk a little bit in this section, I guess, about the big question is, why, why should you come to Imperial to do your MPH? It's a global marketplace. There are lots of places you could go. But I would say, Imperial is a, world famous great institution. It's been going for over 100 years, and we, have recently, in the last few years, had a new president, Hugh Brady, and he's, I think very neatly encapsulated this sort of, idea of what is the driving force of Imperial. It's a science, technology, engineering, and medicine focused university. And so really, I guess, hit on this notion of sort of science for humanity, right? So, across all of those areas, public health fits perhaps most easily into this. But as we're thinking, what are we trying to do, and doing all of this science, and really, I think it's fair to say, public health and the rest of Imperial, we're trying to advance humanity, we're trying to reduce suffering, increase happiness and well-being. Um, there is a cottage industry, I guess, of university rankings. And so, they rank, different universities are ranked for different people in different ways. And as it says, here on the slide, I took this from the website. I mean, the rankings don't actually drive us, right? So, people are not, I guess, getting out of bed, coming to the office, worrying, where are we, sitting in the ranking. But it is worth saying that, Imperial does very well in these rankings. So first in the UK and Europe, second in the world in the sort of QS World University ranking. So rated, I think it's fair to say, consistently highly across sort of different metrics, whether that's actual, science having an impact, whether it's the research being world leading or whether it's actually kind of the quality of the teaching. And so, I think it's fair to say Imperial is doing well in those areas. You go to the next slide, please, Enoch. And, I guess expanding a bit on this, science for humanity idea. I mean, so the new strategy sort of talks a lot about this. I mean, one of the sort of big questions is, how do you maximize, your potential for force as a force for good in the world? How is Imperial doing that? And there's, there's lots of things, but sort of three broad categories of that. Firstly, it's enabling talent. Secondly, it's powering research. And thirdly, it's amplifying impact. And I think if you come to Imperial, come and do the MPH, you'll see that sort of throughout the course, throughout your time here. Enabling talent is, very much a lot of that is you guys, sort of potential applicants, right? So training the next generation, and we have great students, we have great interactions with them every year, and sure, and Kita is a sort of shining example of this. But so partly it's about enabling that next generation of you guys to go on and do great things in the world. Secondly, sort of powering research. So all of the people who will teach you in the MPH are research active. They're sort of pursuing their own research in different areas. Mainly that is in the areas of public health and science, but also actually some people pursuing sort of educational research. How can we best educate people? And thirdly, actually amplifying impact. We'll talk about this a lot throughout the course, and you'll get this real sense from the people talking to you at Imperial. But we're very keen to not just be sort of producing papers, producing reports that just sort of sit on the shelf. It's important to do the papers, it's important to do the research, but that is necessary but not sufficient to actually changing the world and having an impact. It's got this real focus on trying to translate these findings into real world impacts. You go to the next slide, please, Alec. Um, so we've got this new building. You can see a nice picture of it here. And then again, within public health, so it doesn't happen very often. About every 8 years in the UK, the government, broadly speaking, they have this exercise, the research assessment, research excellence framework, where they sort of rate the research done by universities in different areas, and essentially how good it is. And so, Imperial's ranked first in the UK in this public health self-service health services and primary care unit of assessment. So that was the last time this was done in 2021, and then the next time it's done will be not until 2029. But so really, the people who are teaching you are at the forefront of their fields, producing great research, having great impacts. Go to the next slide, please, Hannah. And so this slide, we're not going to go through it in a huge amount of detail. People can sort of look at the recording and sort of look at this. But this, is just to give you, I guess, a bit of a flavour of the, some of the different research being done by the School of Public Health at Imperial. There's this big picture epidemiology, what is happening, trends of non-communicable disease, deprivation and transport density linked to suicide risk. Really, how does the built environment impact health, health networks, cancer clusters, children living near nuclear sites, and COVID. So lots of different disparate research areas. And so I think it's fair to say, the MPH Imperial offers something for everyone in terms of, the big public health research areas that you could be interested in. Next slide, please, Hannah. And so, I mean, that's the sort of Imperial. What is it? What is great about the School of Public Health? Just going to talk a little bit here, I guess, with the key features of the Master of Public Health, and I'm going to hand over to Henoch to talk in a little bit more detail. I guess, about the specifics of what is in the course. But so the key, the key details, the very key stuff. So, we deliver it mainly, the School of Public Health, and Imperial is delivering it. The Imperial Business School delivers some of our modules as well. So you'll have a bit of interaction there. It's full-time for 1 year. So it's an intensive course. Again, I think Ankita might speak to this, but so you could more or less expect to be working kind of full time over that year, primarily at our new building at the White City campus, and there's a bit of teaching at other places in London. We're aimed at candidates from sort of health, biomedical science, management, and social science backgrounds. I would say that we consider that broadly, and if you come from a background which sits slightly outside of that, and are kind of worrying about your eligibility, we very much take a holistic view of what is public health. I mean, what we do know is it's an interdisciplinary science, so you need sort of lots of perspectives, and so it's not the case that we sort of just look at people's applications and say, they did a BA in English literature, they're not eligible. We kind of go beyond that to kind of assess people's, I guess, interests and inclination and skills to contribute to public health. So, very much aiming for that interdisciplinary focus on the MPH that you see in the rest of the public health workforce. Next slide, please, Hook. It is, as I say, it is full time in person. If that doesn't suit you for, there are lots of life reasons that might not suit you. It is worth saying that Imperial also has a Masters in Public Health online, and so that's delivered fully online. And so over 2 to 3 years, and also people can build up in that, so they can do a sort of what's called a postgraduate certificate, sort of broadly speaking, about a third of a master's, or a postgraduate diploma, broadly speaking, 2/3 of a master's, or the whole course of the Masters in Public Health. So if actually coming to London physically doesn't sort of fit with your life, do have a look at the Master of Public Health online. And next slide, please, Hanak. And I think, yeah, I think this is the last slide I'm going to talk about before I hand over to Henok to, I guess, discuss some of the course details a bit. But so some of the core objectives are, it's very much around, providing this sort of comprehensive introduction into key public health topics, health promotion, health protection, health policy, health economics, and health behavior and financing. So we want everyone to have this, core baseline of sort of knowledge across these areas, the things that, even in a changing world, having those core skills isn't particularly changing. And the aim is very much to, give people cutting edge both knowledge and skills. You need to know facts, but you need to know how to apply them in the sort of, the key principles and methods of public health. And we have a quite a strong emphasis on quantitative analytical skills, sort of public health, epidemiology, and health service research. That is changing a little bit over time, probably. When I started about 4 years ago, there was a greater focus on the sort of quantitative skills only. But yeah, we're seeing a real increase in, both interest from students, but also an increase in, I guess, the amount that we're delivering, which is either, based around sort of qualitative methodologies, policy analyses, or sort of mixed methods. So still a reasonable focus on the quantitative elements, but that is changing a little bit over time. And yeah, we very much aim to, provide a creative, supportive learning environment. Everyone who's involved is involved because they like teaching. They like sort of, I say, interacting with sort of next generation of public health leaders. So, these are the big objectives of the course. And I'm going to hand over to Henok to talk about some of the details.
Thank you very much, Anthony. And yeah, thank you everyone again for being here. So this gives us an opportunity to speak a little bit more about the course structure and how your schedules are going to look like, the content. I know there have been a couple of questions in the chat already around what your week is going to look like, so we can delve into that straight. And yes, so our terms are organized around 10 weeks each almost. With a bit more specification around the third term. So you come in October, you'll be in the first term for 10 weeks, and you'll be undertaking the compulsory modules, which are what we call these bigger modules. They are each 7.5 ECTS worth, and they're all compulsory for all of you to attend. There's no choice there, so to speak. And then in the second term, we've got a suite of, mixture of optional modules for you to select, and just one compulsory module, which is health economics. Outside of that, you'll be mixing different optional modules to kind of constitute your ultimately to constitute your stream choice, and we'll be speaking about that. And the third term, I think you're at a stage where naturally you're looking at different courses that are out there and trying to look at to see which one is very suitable for you. And it's worth highlighting that what we feel is really the distinguishing element within our course offering is this big emphasis that we place on your research project. So it's 4 months from the beginning of May to end of August. That's totally dedicated to you undertaking an independent piece of work, but also the fact that we generate over 100, I think over 150 projects for you to choose from for your work. And these projects are drawn from ongoing projects that are undertaken by academics across the School of Public Health and the broader Imperial department. And so we'll be speaking about all of that. So on, the higher level overview, you have your first term, the four compulsory big modules that you'll be undertaking over 10 weeks. And the way we do our modules at Imperial is at the School of Public Health is that each day is dedicated to a single module. So you have this single focus to focus on one module over the course of the day. You kind of shut out the other concerns and the other modules, and you're totally immersed in that module. And it's a mixture of front teaching, interactive teaching led by the module leaders and invited academic staff, but also interactive tutorial sessions that you'll be part of. So it might be that you come in the morning on the first, so Mondays are introduction to statistical thinking and data analysis. So you'll be doing the lecture over the first 1 or 2 hours in the morning, and then you break up into smaller groups to engage in more skills-based tutorial around how you'll be using R for data analysis and how you'd be working around data sets to apply the lessons that you've already learned. The same thing with principles and methods of epidemiology, which will be on your Tuesday schedule. Wednesdays, it's kind of a break at Imperial. The Wednesday morning is dedicated to extracurricular seminars and additional tutorials that you might undertake. The afternoons are left open for you to engage in college-wide societies, sport activities, and so forth. On the Thursdays, you come to my module on research methods, and the same applied sense where you'd be undertaking the lectures in the morning, and in the afternoon you'd be engaged in your own group work activity where you're expected to ultimately at the end of the 10 weeks generate a research proposal together and defend in front of invited academic staff, a panel of academic staff. And then the Fridays is also another full day dedicated to the foundations of public health practice. So this will be the structure of your first term. And then you go into the Christmas break and you come back. There's 1 week that's dedicated for any exams from the first term. And then you go into the second term where you'd have to choose between these choices, and the choices are organized around dedicated streams. So we've got 6 dedicated streams. You could do the health promotion and service improvement stream, the quantitative method stream, infectious disease stream, environmental health stream, health policy and system stream, or the global health stream. So you can mix and match to kind of arrive at your stream choice. You'd have to choose at least 3 from those assorted stream choices and the modules within the streams. But then you'd also have to take the health economics as a compulsory module. At the end of the day, each of you will have the option to pick 6 modules in the second term, right? Not more. So it looks like a very busy period in terms of the high number of modules you'd have to choose from. But ultimately, you'll all choose 6 modules. The 3 will be aligned to your stream choice, and then you have a further 2 choice to kind of pick out things that you're interested in. So as Anthony was saying, public health is such has a very broad scope. So this is our effort to give you flavors into the different strands that make up public health. But also we wanted to give students the opportunity in terms of the career trajectory that they're interested in. Some of you are firmly interested in developing your quantitative analytical skills, so you could join the quantitative method stream. So that will stand you out, later on when you go for job applications or when you apply for PhDs and so forth. And the same with the other streams. And then we go into term 3. And I'll discuss that in a bit. But also, our course assessments are built into this structure. It's not just, the final exam at the end of, we have a few exams, but that's not all that we do. As you go along, you'll be engaged in different innovative, structured assessment methods that we have developed over the years. So you might be doing some academic essays, critical analysis through the 2000, 1500, 2500 word essays, but you'd be engaged in a number of group work and presentation exercises, individual vivas on the back of group work exercises. You'd be asked to develop some vlogs, and simulation exercises, especially for the infectious outbreak assessments, modular assessments. And so, we have all this mix of different innovative assessments, but also we're not going to plunge students into the main assessment without any guidance. So we have some formative exercises and mock. In terms of the exams, you'll be going through mock exams before you arrive at the final exams. All the assessment dates and marking periods will be released to you ahead of time, and you can find this in the module handbooks and course assessment schedules. We've also introduced over the last 2-3 years what we call the academic support and guidance groups. You'd be part of this small group of students that will be meeting with a dedicated tutor throughout the term to discuss any academic questions that you might have, any questions to discuss in terms of study skills, in terms of how to approach different potential challenges that you'll be facing throughout the term and the year. And that's been very productive and has been appraised quite nicely by students. And there are different opportunities, as Anthony has outlined. We have some different research groups within Imperial. They run departmental seminars, and that will be available to you from time to time to attend. There are seminars that are organized at the college level, which will also be available to you through the Imperial Graduate School. There are student-led seminars that are organized through the postgraduate student forum, which you'll be, some of you will be part of that committee organizing these seminars from time to time, and there will be optional academic support and career sessions to attend. And I'm sure you already know about the WHO Collaborating Center annual visit to the WHO institutions in Europe. So it used to be just the Geneva visit that we used to run. But recently we've introduced this Lyon visit, which is this new WHO academy that's been constituted in Lyon in France. And so we've got a second visit going on parallelly with Geneva. And so in each of these visits, we are able to take around 25 to 30 students. It's organized by our WHO. Imperial is one of the few WHO collaborating centers in the world. And so in the picture, you can see Professor Salman Rawaf, who is the director of the center. He always accompanies our students on these visits, and the visits are highly appraised by the students. It's not just institutional visits going around the buildings and visiting those organizations. There are seminars that are organized there for our students, and you get to meet from time to time with high-level officials within these institutions and to discuss some of the pressing public health problems and what these global institutions are doing with those. So to speak about the dissertation journey, as I said, this is very critical for our course, starting from beginning of May. So you will engage in your dissertation, but before that, there's a very clear selection procedure that we set out for our students. So at the beginning of the second term, we release all the projects from our side. We also ask you to develop your own projects if you are interested. A number of you might have been working with different data sets, with different projects, and you might want to extend that work. So we will support you to develop that into a dissertation topic. But on the main, we release those projects, and there's a clear selection procedure. You'll choose, 3 projects from the list that we include, and then you'll be going through selection procedures involving interviews and submitting statement of purposes for your potential supervisors. And then at the end of the second term, you'll all have a project and engage in your work over the course of the 4 months. And this is closely supported by two Imperial dedicated academics will be meeting with you at least twice a month to assess your progress and to give you feedback on your work. And at the end of August, you'll be producing a project report of around 7,000 to 8,000 words, and also will be engaged in a final viva, which is a presentation followed by questions and answers at the end of August, beginning of September. Okay. So, our students engage in a range of dissertation topics and methods, from systematic reviews, primary data collection, or on the main also analysis of large data sets coming from cohort studies or clinical trials. So just to show, maybe that diversity, if you look at the third bullet point there, tobacco control policies in low and middle income countries. So this is a systematic review of evidence of factors that influence the policy process. So you can engage in that high level, policy level investigation. Or if you look at the second from last, investigating associations between urban green space and respiratory disease in the UK Biobank. The UK Biobank is this massive cohort study in the UK. So you will get an opportunity to work with that kind of data set through the topics that are submitted by our academic staff. And so these are a number of our students go on to publish their work in key academic journals, peer-reviewed journals. So this is from a number of years back, access to primary care and visits to emergency departments in England, cross-sectional population-based study. And another one on integrating gender in health interventions for adapting to extreme heat in low and middle income countries. So this is a scoping review, type of systematic review that will be introduced on the course. I was also I had the privilege of publishing with a student a Cochrane review, and the student is now supervising student projects alongside me currently this year. So it'll be you get to involve in all these projects. We said we have this emphasis on quantitative projects, but we are also engaged. We also have sessions on qualitative research and how to undertake those. And so this is a qualitative research that was published with a student a few years back. Additional large data analysis based on the European survey data, public support for standardized packaging and policy implementation, and analysis of European survey data, impacts of rising food prices on nutritional outcomes and mortality of children in low and middle income countries. And this is again a systematic review. And so you have the opportunity to work with this variety of research methodologies, and this all comes from the research ideas and research proposals that we'll be publishing in the second term for you to choose from. So just to speak briefly about the career trajectories of our students, given our focus on these research skills. This comes from a survey we undertook a few years back. I think around 150 thereabouts students, alumni of our school participated. Around 50% work in analyst-related positions, either in management consultancies as analysts. A number of them go on to do their PhDs. Or as research fellows and research advisors. in different institutions globally in the UK and so forth. Our students work with, this consultancy industry in academia, in government public health organizations in the UK and other countries, NGOs and think tanks on the main. And we've got Ankita here, who's just recently joined the George Institute, which is now part of Imperial. So she can tell you about her role and what she's up to currently. So we have a number of structured career support on during your year here. So we organized, continuous career support sessions, but you're also able to access the college-wide career service program, including one-to-one career advice. And these career support activities and sessions, some of them focus on PhD application support for those of you who are interested to progress along that route. There's this course that you can undertake before you come on to the course, which is the Attributes and Aspirations course, which tries to orient you to have this career perspective as you undertake this professional degree, that is the MPH. And finally, some suggested readings from our side before you come and join our course. These are, public facing, public health oriented books that can really show you the implications of the analysis and research work that you can be engaged in and how that impacts public health policy and population level concerns. The Spirit Level, a real favorite of mine, The Art of Statistics by David Spiegelhalter, who is the professor of the understanding of risk at Oxford University. Michael Marmot's work on fair society and healthy lives, and this really personal, ethical, account of how biomedical research can interface with people's lives on at a very deep level. A really, really powerful book, The Immortal Life of Henrietta Lacks. So there are other books, but we thought we've selected this for you to engage with before you arrive on our course. So that ends our presentation. So you already know about the website, but if you have any questions following this presentation, please direct them via this email address, and we'll be answering any questions then. But please do send your questions through the chat, and we'll be answering some of those here, some of them via chat as well. So I'll stop sharing my slide here. And at this point, I will invite Ankita to reflect perhaps on her experience. Maybe if you can say a bit more about your background before you came on the MPH and how you've experienced the course and what you're doing right now and how the MPH might have helped you with that as well, Ankita. Thank you so much.
Thank you so much, Henek. I just want to check if I'm audible and clear.
Very.
Yes, I had Wi-Fi issues which are sorted now. Welcome everyone. It's such a joy and honor to be speaking here, and thank you so much to Anthony and Henek for having me. So yes, a little bit about me. I'm a medical doctor from India, and I graduated from my medical practice and in a very trying time for the world, which was during the COVID pandemic. So my first day as a doctor was actually in the COVID ICU, and it's then when it becomes a very stark reminder that we have public health, which is not just the future as some people sometimes think, but it's the past, the present, and the future all in one. And I always described myself as a doer doctor. And what I realized at that moment was that a lot of doctors were just busy complaining, and they were kind of like armchair activists. And then I realized that it needs to be a doctor that steps into policy and actually discusses all of the issues that we face and finds solutions. And MPH was always on the cards for me. It's something that I realized ever since my first year in medical school, that a lot of my research, whether it was in internal medicine or psychiatry or surgical site infections, always had a public health component to it. And so I would just like to say that I truly believe that medicine cannot be siloed. It isn't just clinical practice, or it's not just public health practice. Public health is relevant in each and every step of healthcare and healthcare delivery. So applying to Imperial was a no-brainer. I had read for many, many years a lot of the work that they'd done and how instrumental they were in even the COVID policies that came out for Europe, and even a lot of strategies that India, my country, followed. And I decided after working in India for 2 years and finishing my foundation training that I really want to pursue a master's in public health, gain that public health experience, and have that reflect on all of the decisions I take henceforth, whether it's in clinical practice or public health practice. And I must say it was one of the best decisions I could have made. And I would like to actually, I took a photo of one of the slides Anthony was talking about, which I think genuinely summarizes the masters so well, which was that Imperial enables talent, powers research, and amplifies impact. Um, in enabling talent, there were so many skill sets I didn't know that I even had until I came and did my master's. And then I realized how I could utilize it, which I think was so, so, so very helpful, because all of the modules that have been discussed so far, I would like to highlight that the way the MPH program at Imperial tests you is not how well you can remember things, not how well you can just rote learn, memorize your modules and your syllabus. It's about how well you can participate in class, how well you can ask questions, interact with the offer, like all the lessons that are offered, and utilize those skills to better your own. Translatable academics is very important in the current job market and in the current space that you are all going to be entering, because there is no lie, it's a very competitive job market out there. And Imperial's ranking is one thing, but the skills you take away from that is extremely important. And that's whether it's in research, or if any of you are ever interested in corporate roles as well. We learned how to pitch. For global health innovations, we had a Shark Tank esque approach. If you're interested in health tech, there are so many growing fields, and this degree really enabled us for that. The assessments were not at all easy, because they were not expecting you to just memorize your course learnings. It's about how well you can walk away with what your professors teach you. And I would like to also say that I had the great, great, great privilege of serving as academic rep for our cohort, which meant that I got to interact very, very closely with the professors. And I would like to speak on behalf of every cohort mate of mine. The professors are the most approachable people, and they're so kind to the students. No question was ever unanswered, no solution was never brought up. They listened actively to every concern a student had, whether it was two students talking about it or 40 students talking about it, which is so imperative in an educational environment. And we never felt like our hand was not held, but we were also pushed to think for ourselves, to question. And I think that is what made this experience even more incredible. In terms of the trips as well, I know a lot of people get very excited, and I'm actually happy I got this with me. I don't know if you can see, but this is a water bottle from one of the WHO trips that we had gone for. And I think it's very uniquely structured into the program in such a way that a lot of the questions that you have across your MPH learnings, you can actually discuss with some industry level experts. And it's not just the WHO trips, mind you. We have commercial determinants for health and health policy, which is headed by Anthony and Hennock. And we had weekly guest speakers that came in and actually discussed their lives, their topics of interest. And so it was a lot of learning by doing. So going to the events as well, it was not just the glamorous bit that you get to go to the academy in Lyon or the headquarters in Geneva. It actually is a practical place for your learnings to be discussed, to meet incredible people. And I think that's a huge takeaway from me as well. And apart from that, I just would like to summarize by saying it was the greatest educational experience I've had, and it helped me greatly. And yes, as Henak said, I'm working at the George Institute for Global Health now. It's been a little over a month and a half now, and it's a partner organization with Imperial. So, in terms of projects that I'm on, actually, they're quite exciting because Imperial works largely in impact, which is so wonderful. Again, the research is not siloed, it's not purely academic either. If there is an academic component, there will be a tangible output, which is quite exciting. And so I get to actually work on a very cool public health project. It's kind of top secret now, so I can't divulge more information, but it's in the health tech, health educational space. But the other project that I'm also on is it works on establishing gender and sex differences in cancer clinical trials. So, like I said, everything's interdisciplinary, everything's exciting, everything has an actionable output, and that's what I think is the biggest takeaway from an Imperial Masters of Public Health degree. You will find your own place. There are no silos, and you'll realize very soon how limitless your your experience can be. Thank you.
Thanks very much, Ankita, and it's really, really great to get that, really positive reflection from, one of our students. But also, Ankita did not mention, but Ankita had a very impressive year with us. She was the student representative, and she went away at the end of the year with the best overall score, with the best dissertation. So congratulations again, Ankita. But I wanted to raise something related to that, right? So a few applicants have been asking here about the intensity of the course and how, we always get those questions, but how have you handled that, work-life balance and the intensity of the 1 year immersion in all these aspects of the learning at on our course?
I did notice a question about attendance as well, and I think something that greatly helped me was to not leave things for later. I think I had almost 100% attendance in every module except one. Because I just, and also I didn't like missing classes because there was always so much class participation. We had a very wonderful cohort, so there was a lot of learning between each other. But I think it's been structured very intentionally. I would say engaging with the pre-course modules, the modules, and the post-course modules on a regular basis. So almost on a daily basis. I don't think I ever left those days coming back from lectures as well. I would always work for 2, 3 hours. Assessments at the MPH and at Imperial, if you think it'll take you a week, it'll probably take you 2 to 3 weeks. If you think it'll take you 2 weeks, it'll probably take you 4 weeks. So I would always start earlier, much earlier than a lot of my cohort mates, and I feel like that probably helped a lot. There were a lot of extra material that you would have in the course modules that you would have included, additional literature for us to read. I would always be engaging with that, and I think that helped greatly as well. And in terms of the dissertation, yes, it was a very intense period. I think term 3 was the most intense. Work life balance is not difficult to have if you create a timetable for yourself. I almost always had weekends to do that, but that was only because if we had a 9 to 4 day, I would come back home, take a 2 hour break, and then work 6 to 9. So I would always make sure that, and again, I think the attendance really helped because a lot of my queries could be answered then and there during breaks, discussing with professors, discussing with cohort mates, us all ideating together. So I think that's how you establish that work life balance. And but yes, term 3 is intense. And I was also juggling my license prep then. So my medical license for the UK. So I was doing both at the same time. So perhaps it was a little bit more intense for me, but not necessarily for someone solely doing their dissertation. I also saw Anthony mention not to do additional jobs. I think that helped a lot. Doing a part-time job and expecting excellence in grades is going to be very difficult because this is a very demanding course. Like there's no mincing words about it. But I think it's also very exciting, which a lot of us had as a big takeaway, which motivated us to keep attending.
Thank you so much, Ankita, once more. I saw there was a question about um, about the dissertation and asking if I could elaborate on some aspects of the example projects that I shared earlier. So just to highlight, some of how we've grouped them here as well. So I don't know, some of you would be familiar with the systematic review methodology. So you could do a systematic review on your own chosen topic, or on a number of our academics would also share a systematic review idea. You could do a meta-analysis or a narrative synthesis on the back of that. So that's the first group of projects that we've shared here. And also you could be engaged in primary data collection and what we call primary research. And this could be you going out and undertaking a qualitative piece of work. Will you be undertaking qualitative interviews, or collect some survey data yourself and undertake that? We'll make sure that your project idea is feasible to be undertaken over the course of 4 months, especially when it involves primary data collection. But on the main, we've got access to large data sets with pressing research questions, part of broader research groups and research programs at Imperial. So you'd have the opportunity to synthesize aspects of that data and contribute to that research output. And this could come from ongoing clinical trials at Imperial, or data collected as part of the global research teams at Imperial. This could be data collected on nutrition in Peru, or in Uganda or Ethiopia, different settings from the UK, routine data from health institutions, from the NHS, trying to answer different questions, and you'll be part of those studies as well. You have the opportunity to propose your own studies, and some of our best dissertations in the past have been studies that have been proposed by students. But we'll be working with you to make sure that you're able to develop that into a realistic and answerable research question within the scope of the 4 months you have for your dissertation. Hopefully that explains that aspect of the question we had. And there's a question around where one could download the syllabus and find a list of study materials. So I don't think we're sharing the handbooks nowadays on our web pages, but we could share the handbook for this past year. For this current year for us, along with when we share the recordings to you after this presentation. So you can have a detailed look at it's a detailed course handbook that we have, including who'll be teaching which modules, what kind of modules there are, and all the course level information that we've provided here. So hopefully that will be of help. Any other questions you want to pick up on, Anthony?
No, I was going to. There was a question about the support through the dissertation, but I see Ankita, you've sort of keenly got in there, and answered that. Yeah, and I was, I mean, we've, quite recently started that for the students this year, and yeah, so I mean, the idea is it's sort of independent research project, but yeah, supervisors are engaged, and they're, I mean, either it's a question that the supervisors have sort of proposed they, would like an answer to, Or it's, a sort of interesting question people have brought themselves. So, yeah, so people are sort of interested in, finding out the answers to these questions, but also in, students as people. Yeah, so we very much, it's independent, but we very much keep a close eye on people to make sure people are adequately supported, and people, yeah, people enjoy it. It's, the closest thing to, I guess, having a research job. In the course. So yeah, so people are well supported there as throughout, I would say. But yeah, I don't think there are any other open questions unless people have any burning ones towards the end.
Yeah, we've got about 4 minutes, and maybe people might ask some further questions. But in the meantime, just to also follow up on what Ankita said in terms of the intensity of the course, and for a number of you, you'll be undertaking this course as an international students, and a number of us on the course have had that experience. We've been part of a Master of Public Health or Epidemiology course, so we can all relate to that. So we'll be sharing our experiences, and there will be close support. The course team are very accessible. The 1 year intensive course in the UK, wherever you might do it, is an intensive experience. So there will be a number of sources of support and advice from us and different teaching staff and your colleagues and other mechanisms that we have in place. Yeah, I see there are a couple of questions.
Yeah, thanks. And someone's asked about the, I guess, the profile of the students. And I mean, I haven't got these sort of numbers off the top of my head, but I mean, it's worth saying, I mean, the majority of people are international, right? So so certainly, like Hanok says, yeah, don't have that feeling that you'll be in some way sort of alone or isolated as an international student. The majority of people are international students. And we have I mean, there's a range, I guess, in terms of people's ages and experiences. I mean, there's a reasonable proportion of people who've quite recently sort of like finished their undergrad. They've done a little bit of work experience, they've done some internships and so on. But then also, that kind of goes up to, people, more sort of mid-career, sort of in their sort of 40s or 50s who've like worked for a time and then sort of come back. So yeah, so it's a range there, but I would say certainly a lot of international students, and certainly every year always, some people who've, got significant amounts of experience.
Great. Thank you, Anthony. And this question around what graduate roles that people go on to do in the companies, number of our students go on to work with the National Health Service in the UK, the UK Health Security Agency, different think tank and consultancy groups like we highlighted earlier, but also some go back to their countries and work with the Ministry of Health or international non-governmental organizations, with some of the global health initiatives such as Gavi, the Gates Foundation, the Clinton Health Access Initiative, and so forth. So it's quite a spread in that regard, but a sizable number go on to do their PhDs as well at Imperial, but at other academic institutions as well. Any other question you want to pick up on in this last minute?
I don't think so. Not for me. Oh yeah, so I mean, this has sort of come up before. Interested in pursuing an academic career. Yeah, so I mean, we have there's a reasonable proportion of people who sort of always sort of go on to pursue an academic career. I mean, the usual thing is, either people, try and sort of get some, research assistant or equivalent experience, and sometimes that, can be with the people you've done your dissertation with. You sort of built those sort of relationships relationship with those people at Imperial. Probably more commonly, I mean, a lot of people, go and sort of get a scholarship to fund their PhD. And some people, manage to, there's a bit of a lag there. Some people manage to sort of apply when they are on the MPH to start right afterwards, or some people have a little bit of a gap. But yeah, certainly, the MPH to PhD pathway is well trodden, and lots of people have done that.
And sometimes people have gone to teaching roles through the teaching fellow opportunities as well. We've got at least a couple of people who are senior teaching fellows and working with us who are part of the Imperial's Master of Public Health cohort only a few years back. So that does happen as well. But yeah, these academic opportunities at Imperial, but also at other institutions. So yeah, really great to speak with you all and to discuss the course and field all your questions. Hopefully, we'll be seeing some of you in October. We look forward to that. Thank you very much from all of us.
Yeah, thanks, Henok. Thanks, everyone, and particularly thank you and Keita. And yeah, hopefully see some of you very soon.
Yeah, thank you everyone and good luck.